us who
Yeah,
want to
I
have
was like,
a somewhat normal life.
I was in my 20s then.
Yeah.
Crazy. I still love it so much. I can't wait to do this.
Alright. So now, Aaron, coming back to the one positive that I can think of that will perhaps make everything I just said not be accurate and true. So, unlike medical insurance, dental insurance is not meant for catastrophic situations. This means people are not as scared to have it. They may continue to be comfortable to pay an extra $100 just to have their teeth cleaned and not have dental insurance. Whereas, I'm going to pay whatever I have to have medical insurance because my spine surgery costs $300,000 and I don't want to have to pay that. With dentistry, insurance maxes out at $1,000, $1,500 maybe, something like that. So, it's not that bad to not have it. So, this may be our one saving grace, that because the insurance model only goes up to that amount and it hasn't changed for years, people may not care as much if they don't have dental insurance, and maybe a certain percentage of the population will still live without
That's a really good point, actually, sir. I
Yeah.
thought of that one.
Oh, thank you. I'm sure I still
Because the annual reimbursement is stayed at static.
And even if it goes up, even if it goes up to 2,000, even if it goes up to 3,000, you know, it's not
It's
like
true, that does kind of dissuade people from sticking with insurance.
yeah. And a
I
lot of my
never
patients,
thought about that positive way.
One of our
Very
patients,
good.
once we've gotten out of them, we do the in-house plan.
Yeah.
And people are like, all right, down, and we offer, so it's like exam and cleanings are free. If you're a perio patient, you get 4 perio exams for free, x-rays are free. I mean, it's like a $600 a year.
so plus people $600 a year.
$600 a year, you can do 60 a month or something. And then you get 15% off of any dental procedure that we do for you.
That makes sense too, with like digital x-rays and cost for anything to do the radiograph.
Yeah, right, it's not like we're losing money on the x-rays, the exam, like, sure, the 50 or 80 bucks, you know, whatever.
Yeah.
But patients have really jumped on it.
This has been a good thing.
Yeah, they have, because like they hated self-dental, they hated jumping through all the things, so once we got out of network with them, we've had a large number of patients who said, screw the insurance, I'm gonna spend an extra $300 and just go with your plan, and I like your dentist.
This very well maybe are saying, you know, stuff like this, in-house plans.
Now think about it, if you have 2,000 of those patients, January 1, you collect 1.2 million.
Yeah.
600 times
2,000.
2,000.
That's if every patient's in-house membership plan.
You start with 1.2 in the kitty, and then
Oh, wow.
you're reducing what you're
Right,
collecting,
50% off.
but the reality of it is,
Whatever, that's still way less than
That's
the
right.
insurance.
It's great for
fees.
cash flow too.
that's the thing with these
50%
concierge
off or some
plans.
shit.
Yeah,
Mhm.
if they can get a certain threshold of patients, it's no brainer.
No, we've had a lot of people jumping onto it, and they've been happy with it.
Anybody else do in-house plans?
I do.
Is yours kind of similar like that?
Similar. It's like maybe 200 for the year.
Mhm.
Then I can keep track of the discount rate just because it breaks down by really what I like to do. It's I don't like. I don't like doing something. You're not getting that much.
I love it.
About a denture or something. Sorry. For
No,
it.
no.
See you.
The denture's still $5,000. Sorry.
Yeah.
Red.
Yeah.
Do you guys use do you outsource it to a company to run the plan for you, or do you do it yourself?
Yeah, because we use Open Dental, and so it's very easy, like the staff just puts it in the insurance section of it, and then it automatically applies the discount and everything, and it has it there on the membership plan, so we know they're not getting charged for.
That's awesome.
To clean, yeah. And the world is moving to the more subscription-based model. So consumers are more trained to be accepting of something like this, perhaps, and that's how Costco makes all their money. So not as much profit stuff they sell, but stuff that of their membership. So anyway, finally, another favorite quote of mine: "Knowledge is not power. Knowledge is only potential power. Action is power." So my goal for this was to just maybe bring this to light and make you guys think about something that you don't think about every day. And if I've done that, then I've done my job. And if you think of one thing from this, if you remember even one takeaway from this, then I've had a successful presentation. So thank you, everybody.